This is Damian McNamara with Global Medical News Network, and I'm here today with Dr. Norman Wolmark of Allegheny General Hospital in Pennsylvania, and we're at the annual meeting of the American Society of Clinical Oncology. You just presented some information about a 3-year follow-up trial and more than 2,000 patients with colon cancer, and you were comparing a group that was treated with adjuvant bevacizumab compared to a control group that just got chemotherapy. And you found that the disease-free survival endpoint, which was your primary outcome, was not significantly different at 3 years. Can you tell me if you were surprised by this outcome?
We were certainly disappointed. We were hoping that a novel, interesting, exciting reagent such as bevacizumab, which is a humanized monoclonal antibody that targets VEGF, that was shown to prolong survival in advanced disease when transposed into the adjuvant setting for early colon cancer, stage 2s and 3s, would result in a robust disease-free survival benefit and ultimately lead to an increased rate of cure for our patients with early stage colon cancer. Alas, that was not the case. The positive aspects to this trial, I mean the silver lining, I would say that we failed, but we failed with distinction. Is that we learned a great deal more about how to use bevacizumab to optimal efficacy. And that what we saw is that during the interval that bevacizumab was given, the 1 year, and as you so appropriately noted, 6 months beyond the chemotherapy, we saw a robust effect. We saw a hazard ratio of 0.6, which translates to 40% reduction in event rate while the bevacizumab was given.
What kind of toxicities did you see with bevacizumab in the trial, and would that be an issue over, if it were to become a maintenance therapy in the adjuvant setting?
Yeah, well, it's something that can't be dismissed, obviously. Having said that, because this is the adjuvant setting where the primary is resected, the bevacizumab was remarkably well tolerated. Carmen Allegra presented the toxicity data from this trial a year ago at ASCO, and it's available online, JCO, as of May 4th. And remarkably, it was very well tolerated. We had a 12% incidence of grade 3 hypertension. We had about 11% compared to 6%. With pain, we had proteinuria. We had some wound issues that were not particularly serious. So all in all, it was well tolerated. We did not see an excess of perforations with bevacizumab of hollow viscera. We did not see vascular thrombotic events, an excess of that. So in the adjuvant setting, it seemed to be very well tolerated at the dose that we utilized, which was 5 milligrams per kilo.
I've heard estimates of 80,000 a year, 90,000 a year. Is that in the ballpark, you think? Or?
Well, certainly right now it is.
Okay.
I mean, if it were to become used in a prolonged or even a chronic fashion, I'm sure that this would be factored into the cost.
So could you see this at some point being used more than a year or more than 2 years, kind of as a maintenance therapy for these patients with colon cancer?
Well, our hope is that the next NSABP trial would assess bevacizumab for longer durations. And we haven't finalized what that duration would be, but certainly, we're thinking in terms of 2 years. And of course, we raise the appropriate question as to whether bevacizumab should be used, as a chronic intervention.
This is Damian McNamara with the Global Medical News Network.